Hello everyone, Assalamu alaikum. Welcome to Medics Live. আশা করি আপনারা সবাই ভালো আছেন। So today is our fifth class of Comprehensive Language of Medicine course. So let's get started with chapter 5, which is going to be endocrine system. So the objectives today are introduction of the endocrine system, list of the endocrine glands, endocrine versus exocrine glands, the hormones and their corresponding functions, pathological conditions, symptoms of endocrine systems, and laboratory investigations, and few abbreviations. So what is endocrine system? So this is a chemical messenger system which comprises of feedback loops of hormones released by the internal glands or endocrine glands directly into the blood, okay, or the circulatory system, which regulates the distant target organs. So if you want to make a simple definition, so in that case, these two highlighted words, you can actually combine it. And the definition would be endocrine system is a system where hormones are released from the endocrine gland, which acts on the target organs, okay, to make a simple version. Now, second is what is hormone? Okay, so hormone is a chemical substance which acts as a messenger molecule and produced by the glands that are transported by the circulatory system to distant organ to regulate the functions. So a simple definition would be hormone is a chemical substance which are produced by the glands and acts on the target system to regulate the functions. All right, next slide. List of endocrine glands. So before going through this slide, let's have a look at the image. So as you can see, these are some of the important endocrine glands, okay? So starting from the top, from superior to inferior, so the first gland is the pituitary gland, okay? Can you see at the base of the brain? In chapter 1, I remember teaching that brain has two parts, cerebrum and cerebellum. So underneath, near the cerebrum, okay, the pituitary gland is situated. The second gland is pineal gland, okay, pineal gland. Third is thyroid and parathyroid. For priestly purpose, we won't go into details of hypothalamus, okay? So we'll be dealing with the important ones only. So the third gland is thyroid gland, which is located in front of the trachea. Remember, we did a question session last time in chapter 4, okay? So this is a butterfly-shaped gland located in front of the trachea, and dorsal or posterior to the thyroid gland, there is two pair of parathyroid gland. Para means on either side, okay? Then we have thymus, okay, thymus. So what does thymus do? Thymus is such a gland which is present when we are in our childhood, but once we grow up, okay, it becomes redundant or it becomes functionless. So initially what happens, the thymus provides immunity for us or protection for us. Next, in the abdominal cavity, we have pancreas. Then we have adrenal gland, okay. Now adrenal gland, the details will be discussed in the next chapter, which is going to be urinary system, okay. So for today, you just have to get familiar with the term. So adrenal gland is located at the top of the kidney, okay, at the top of the kidney. The other name for adrenal gland is suprarenal gland. Supra means above and renal means kidney. So adrenal or suprarenal gland. The next gland and the last one is, in case of female, it is going to be ovary. In case of male, this is going to be testes. Okay, so let's have a review from the previous slide. So endocrine glands, so these are the list of glands for now. Pituitary gland, which is also known as the master gland. Pineal gland, okay, pineal gland usually regulates our sleep cycle, okay. It releases a hormone known as melatonin, okay. What happens during night time? Melatonin is being released from the pineal gland, which kind of insists or pressurizes the brain to become a little bit sleepy, okay, and we fall asleep. And in daytime, what happens? The melatonin, okay, it's being broken down. So as a result, what happens? We become more alert. Then the third is thymus gland. Okay, it usually provides immunity during childhood. Then we have the thyroid gland. Thyroid gland usually releases thyroid hormones, which helps in metabolism. Next, we have parathyroid gland, which basically acts to control the calcium level because it releases a hormone known as parathyroid hormone. Then we have pancreas, which is actually a mixed gland, and I will be discussing in details in the next slides. Adrenal glands located at the top of the kidney, and lastly, ovary and testes. Okay, so let's have a recap of what we did today. So the first thing we did was the introduction, the definition of endocrine system and what is hormone. The second thing we saw the image where the location of each endocrine gland has been visualized here. Okay, and thirdly we went through the list of the hormones and some functions of it. Next is endocrine versus exocrine. Okay. Now, endo means inside, exo means outside. So, what is the difference between endo and exocrine gland? So, endocrine gland. Okay. So, let's have a look at the image at first. Okay. So, this is the exocrine gland. This is an endocrine gland. So, as you can see, in exocrine gland, all right, the secretions or the enzymes, these are present inside this cavity. Okay. And when there is a stimulation, what happens? The secretions tries to move outside with the through the duct. Okay, duct is basically a tube-like structure. Okay, which aids its passage. So the exocrine gland stimulates and releases the chemicals with the help of the duct. Okay, to the outside. So this is known as exocrine gland. And in case of endocrine gland, what happens? As you can see here, these are the endocrine cells. So what happens? It doesn't have a duct. So the first difference is there is a duct present in exocrine, but in endocrine, we do not have a duct. So what happens? In case of endocrine, the hormone is directly released inside the blood, okay, without the help of a duct. But in case of exocrine, what happens? It is released inside the cavity, and from there, it performs its function, and it also has a duct. Okay, now let's have a look at these definitions. The endocrine gland are often ductless gland. They do not have a duct, and they produce hormones that are released directly into the blood. One of the important example is insulin. The second one is exocrine gland, which have ducts and they carry their secretions outside with the help of a duct. And examples are salivary gland, tear gland, and sweat glands. Okay, so let's have a look at the images. Okay, so these are some examples of exocrine gland. Okay, so at first we saw the examples of endocrine gland. Okay, here around 9 or 10, but for pre-AST we are going to focus on very few of them. Okay, and exocrine gland, as you can see the images. Okay, so in digestive system, remember we studied salivary gland. Okay, there are 3 pairs of salivary gland which releases saliva. Okay, and aids in digestion of carbohydrate. So as you can see, this salivary gland, they possess a duct, a tube, okay, through which the secretion has been released. Second example, this is a pancreas. Okay, this is a pancreas. As you can see, this is the duct of the pancreas. Okay, duct of the pancreas, and these are the cells where the enzymes or the chemicals are stored. So what happens when food enters the duodenum? Okay, fatty food enters the duodenum. What happens? From the gallbladder, bile is being released, and from the pancreas through the duct, all the enzymes, which is amylase and lipase, are being released. Okay, so this together they helps in digestion. All right, so this is another example of exocrine gland. So in case of pancreas, there is an exception. Pancreas is a mixed gland because it has both exocrine and endocrine function. Why? Because the exocrine part is the enzyme and the endocrine part are the hormones, which is insulin and glucagon. Okay. Now the third one. So in case of skin, okay, the study of skin is known as dermatology. This is the layers of skin. So the upper layer, this is known as the epidermis, okay, the one which can be seen from outside. The layer beneath it, the thick layer, this is known as the dermis. Inside the dermis, we have the hair follicle. Attached with the hair follicle is a gland. You can see this blue color gland. This is known as the sebaceous gland. Okay, so what happens? oil is being released from this gland. Okay, so this gland, as you can see, it's releasing its secretion with the help of a duct, right? So this is sebaceous gland. So this is also an exocrine gland. And the other example is this green colored structure. This is a sweat gland. Okay, so what happens? As you can see here, we have a duct. So this is also an exocrine gland. Okay, so these are the examples of exocrine gland. So the main difference is exocrine gland has a duct, endocrine gland doesn't have a duct. Endocrine gland usually releases hormones, exocrine gland usually releases chemicals or enzymes. Okay. Now these are the examples: sweat gland, sebaceous, salivary, and mammary. There are other examples as well, which is pancreas, then tear gland. Okay, gastric glands. There are a lot of examples. Okay, but for pre-ST, you just have to focus on this few. Okay. All right. Then the next slide: hormones and functions. So at first, we are going to have a very superficial idea, okay, about the glands, along with the hormones and their functions. And in the next slides, it will be a little bit in more details. Okay, so let's have a look. So the first gland, pituitary gland, located at the base of the brain. This is the master gland. Why is it the master gland? Because it regulates function of all other gland. Okay, so this is why this is known as the master gland. So the pituitary gland, it releases the hormone. Okay, one of the hormone is known as growth hormone. Okay, which increases, which helps in increasing our height by growth of our bones. So it regulates growth, controls the function of other endocrine glands. Okay, so this is the function. Next is thyroid gland, located in front of the trachea, a butterfly-shaped gland. The hormone released is thyroxine. Okay, as you can see, the name is very similar with the gland. So thyroid, thyroxine. It controls our metabolism. Okay, so what is basically metabolism? This is a combination of catabolism and anabolism. So this is basically how, suppose if I give a very simple example, if you take some food, the time taken for the food to be broken down from complex to simple substance, okay, is usually regulated, and that kind of, depicts our metabolic rate. So what happens if a patient has more thyroid hormone, which means the metabolic rate is high, and if a person has less thyroid hormone, the metabolic rate is low. So usually patient who has high level of thyroid hormones, usually they tend to lose weight. They don't gain weight. But in case of patient who has very less thyroid hormone, they tend to gain weight because the metabolic rate is very less, and the patient can't break down food compared to a normal person. All right. Next is the important one, adrenal gland. Okay, adrenal is a very important gland. All right. So what happens? Adrenal gland is located in at the top of our kidney. Okay, and usually it releases a hormone known as adrenaline. Okay, usually we call it fight and flight mechanism. Okay, fight and flight mechanism. So whenever you kind of face any danger, or whenever you are in a crisis situation, what happens? This hormone is being released, which prepares our body for emergency conditions. All right. Next is pancreas. Pancreas is a mixed gland, but for now we are going to focus on the endocrine function. So this is going to be insulin. So what does insulin do? It controls our blood sugar level. So what happens if a patient doesn't have insulin, or what happens if the pancreas doesn't release insulin? At that moment, the condition is known as diabetes. Okay, I will go into details of diabetes after, in the next few slides. All right. Then we have, in case of male testes, which releases testosterone, the male hormone for growth and development of the male reproductive system. And lastly, ovary, which is present in female, and it releases estrogen and progesterone, which controls the growth and development of the female reproductive system. Okay, so which actually helps in both release of the ovum, and in pregnancy as well. All right. So these are the hormones and the subsequent functions. Okay. So now let's go a bit into details. Okay. All right. Now, আচ্ছা, এখন এই ইমেজটা দেখে কিন্তু kind of you guys are panicking, right? যে এতগুলো হরমোন, so many glands, how should I remember it? এতগুলো কিভাবে করে মনে রাখবো? Okay. So the good part is, the good news is, okay, if you see the next picture, all right, so I have deleted few segments. So এখান থেকে আমাদের just কিছু কিছু অংশ মনে রাখতে হবে. You don't have to remember the others. ঠিক আছে? Okay. So the first gland, pineal gland, releases the hormone melatonin. Okay, regulates our sleep cycle. The second hormone, pituitary gland, releases several hormones. Okay, it's around 6 to 8 hormones. In the first slide, we discussed about growth hormone, which is known as GH, okay, regulates our growth. And these are the other hormones, all right? So the other name for vasopressin is known as ADH. This will be discussed in more details in urinary system. But for now, you have to remember the other name for vasopressin is known as ADH. The full form of ADH is antidiuretic hormone. Okay, antidiuretic hormone. All right. So question for you guys for today is write down the abbreviation of ADH. Okay. In the comment box, you can put your answer. I'll have a look at it at the end of the session. So write the full form of ADH. You can use Google and write your answer. All right. Making it easy for you. Okay. Next is thymus. Thymus helps in immunity. Then pancreas. Pancreas releases two important hormones, insulin and glucagon. Ovary releases estrogen and progesterone. Then we have testes, which releases testosterone. Now the inactive version is known as androgen. Okay, androgen is actually converted to testosterone, but for pre-ST, if you say testosterone, that's totally fine. All right. Adrenal gland, it releases adrenaline. Okay, and some steroids. Okay, in pre-ST, we are going to make it a little bit in more details, but for now, just you have to remember adrenaline. All right, thyroid releases thyroxine, and now these are the three important hormones which you have to remember: T3, T4, and calcitonin. Okay, so thyroid releases three hormones: T3, T4, and calcitonin. And in case of parathyroid, PTH, parathyroid hormone. Okay, so the name is very similar. You can actually easily remember it. So parathyroid gland releases parathyroid hormone. Okay, so these are the total gist of the gland and the related hormones. Now, in case of scribing, what happens when a doctor examines a patient? So suppose a patient came with a thyroid problem, okay, enlargement of the thyroid gland and severe pain in the neck region. So what does the doctor do? The doctor asks dictates to the scribe that scribe, this patient has a thyroid condition. Please prescribe the patient or advise the patient to do some blood test. Okay. So advise the patient to do some T3, T4, and calcitonin. Okay. So doctor is going to actually dictate it to you. But to have a better understanding what the doctor is saying, it's better if you guys go through the terms. Okay. You don't have to memorize everything, but you have to become familiar with it. All right. Because no one is going to ask you, what are the hormones of thyroid, tell me in details or anything. It's just during the dictation, you should be able to comprehend it and write it in your document. All right. Okay, great. Okay, so now let's have a recap once again. So we discussed exocrine and endocrine glands. Okay, as you can see, the difference is in case of exocrine, we have a duct. In case of endocrine, we do not have a duct. Usually the secretion are enzymes in case of exocrine, and in case of endocrine, it is usually hormones, and it is directly released inside the blood. Okay, unlikely of exocrine. Next is these are a few examples of exocrine glands: salivary, pancreas, sebaceous gland which releases oil or sebum, and sweat gland which releases sweat. Okay, next these are some of the important hormones and functions. Okay, and this picture is important. Actually, you can find it in Google as well. I just have to minimize this these regions. Okay, so the first gland is pineal gland, which regulates our sleep cycle. Second is pituitary gland, the master gland, which releases some important hormones. So for today, you have to remember growth hormone, TSH, and vasopressin. The other name for vasopressin is ADH. Okay. And then for pancreas, insulin and glucagon. For ovary, estrogen, progesterone. For testes, testosterone. For adrenal gland, the name of the hormone is very similar to the gland itself, which is adrenaline. Then for thyroid, we have T3, T4, and calcitonin. And for parathyroid, parathyroid hormone. Okay, so these are the endocrine glands and hormones. Next, the master gland, pituitary gland. Let's have a look at it. So pituitary gland is a small gland located at the base of the brain, consists of two parts, anterior and posterior lobe. I hope you guys already know what anterior means, which means in front, and posterior means behind. Okay, so let's have a look at this. Okay, at first this image, as you can see, this is the cerebrum. Okay, the brain. This is the section of the cerebrum. At the base of the cerebrum, there is a bone here, okay? There is a bone. This is known as sphenoid bone, okay? Sphenoid bone. At the top of the bone, there is a cavity. Okay, let's look at the other part. This is magnified. Okay, as you can see, this is a sphenoid bone and this part is magnified here. Okay, here the pituitary gland is located. Okay, so the pituitary gland is located at the base of the brain, at the top of the sphenoid bone, known as the cavity, known as the sella turcica. For pre-ST, you just have to remember base of the brain and the name of the bone. Okay, sphenoid bone. Okay, now this is the pituitary gland. The first part, this is the anterior lobe or the front lobe, and this is the posterior lobe. So these are the hormones released from the pituitary gland. So for pre-ST, for now, for the live session, actually not for pre-ST, just try to remember growth hormone GH, thyroid stimulating hormone TSH, and vasopressin or ADH. Okay, these three hormones, if you remember for now, it's going to be very easy once you join pre-ST training. Okay. All right. Okay. Before that, I'll give a heads up what TSH is. So TSH is basically known as thyroid stimulating hormone. Since pituitary gland is the master gland, so the function of the master gland is to stimulate the other glands. So pituitary gland stimulates the thyroid gland as well by the help of TSH. Okay. So the full form of TSH is thyroid stimulating hormone. So once the TSH is being released from the pituitary gland, it acts on the thyroid gland, okay, and it contracts the thyroid gland to release the thyroid gland's hormone, which is T3, T4, and TSH. Now the next slide, thyroid gland, okay. So the thing I just discussed about the TSH. So as you can see, this is the pituitary gland. It is releasing TSH, okay. Now the TSH is stimulating the thyroid gland to release its hormone. So the thyroid gland is releasing T3, T4, and calcitonin. Okay. So these are the four hormones you have to remember. Usually whenever a patient comes to us for any disease or any condition of the thyroid, we advise the patient to do these tests, okay, these blood tests. Okay. So if a patient has high level of thyroid hormone, we call it hyperthyroidism. Hyper means more. If a patient has low level of thyroid hormone, in that case, we call it hypothyroidism. Okay. So let's have a look at thyroid gland once again. So thyroid gland is a butterfly-shaped gland located in front of the trachea, and it releases some important hormones. One is T3, the other one is T4, and then calcitonin. And it is controlled by the pituitary gland, which is the master gland, by the hormone TSH. So the full form of TSH is thyroid stimulating hormone. Okay, now what are the diseases or abnormal condition of thyroid gland? Okay, initially we just discussed that increased hormone is known as hyper and decreased hormone is known as hypo. So anything above the level of normal is going to be hyper and anything below the level of normal is going to be hypo. So the first one, enlargement of the thyroid gland, is known as goiter. Okay, let's have a look at the image at first. So this is a patient with a goiter, okay, enlarged thyroid. So usually enlarged thyroid or goiter doesn't actually indicate that a patient has hyper or hypo. Okay. So how can we diagnose if a patient has hyper or hypo? By seeing the clinical signs and as well doing the blood tests. Okay. So we cannot actually confirm just by seeing a goiter and give a diagnosis that the patient is hypo or hyper. So at first we have to examine the patient and find the clinical signs, and second we have to do the tests, okay, which is T3, T4, TSH, and come to a conclusion. So this is a normal thyroid gland, as you can see, and this is an enlarged thyroid gland. Okay. All right. So the first condition is known as goiter. The second condition, hyperthyroidism, which means hypersecretion of the thyroid gland. So in case of hyperthyroidism, we have two more synonyms. So the number one is thyrotoxicosis, and the second one is Graves' disease. Okay. So these are some important terms. For the live session, try to just get familiar with it. But once you come to pre-ST, we are going to discuss it in more details. Okay. So what happens in hyperthyroidism? The patient has increased secretion of T3 and T4. Next, we have hyposecretion, which is known as hypothyroidism. So in this case, the level of T3 and T4 is low. Okay. Now, what does serum mean? Serum is a portion of the blood, okay, the whitish portion of the blood. So in that case, whenever we do a blood test, we usually write serum blood test, okay, which is like serum T3, serum T4. Rather than writing a blood test of T3, T4, we usually write it serum T3, T4, serum TSH. So this should be commonly used while scribing, okay. Next is, what is the difference between hypo and hyperthyroidism? So hyper means the patient has more thyroid hormone. Now what is the function of thyroid hormone? Thyroid hormone usually controls our metabolic rate. So a patient who has more thyroid hormone, which means the patient's metabolic rate is more, right? Similarly, a patient with less thyroid hormone means the metabolic rate is low. So a patient having more thyroid hormone will have increased heart rate, rapid heart rate, tachycardia. Okay, weight loss, more the metabolism, faster the food is being broken down. Okay, so the patient will have weight loss and more the calories being burned. Okay, so metabolic rate increase means the patient's more calories being burned. Okay, third is the patient, since metabolic rate is more, the patient will feel very hot, so heat intolerance. Okay, the patient won't be able to tolerate any kind of heat. Okay, next important one is hair loss. Okay, this is also a feature of hyperthyroidism, and since metabolic rate is more, patient is going to feel hot. As a result, patient will have a lot of sweating. So for now, these are the important ones. Out of all of this, you just have to remember few differences. Okay, so number one is hair loss, number two is sweating, rapid heart rate, weight loss, and heat intolerance. Okay, now for hypothyroidism, since the metabolic rate is less, the patient will have less calorie burn. Okay, and food will be digested very slowly, so the patient is going to tend to have more weight gain, slow heart rate, puffy face. Face will be like a moon. Okay, moon shaped face, dry and coarse hair, dry skin. Okay, and cold intolerance. In case of hyper, it is heat intolerance. In case of hypo, since the metabolic rate is low, patient is going to have cold intolerance. So these are the examples, sorry, these are the differences of hypo and hyperthyroidism. So let's have a recap of what we studied from pituitary gland. So pituitary gland is a master gland. Okay, it has two lobes, anterior and posterior lobe. It is located at the base of the brain in a cavity known as sella turcica, which is present in the sphenoid bone, and it releases several hormones. So for the live session, try to remember growth hormone GH, thyroid stimulating hormone TSH, and vasopressin. And the other name for vasopressin is ADH. Okay. Next is thyroid gland. So as you can see in this image, the TSH is controlling the thyroid gland, and the thyroid gland releases T3, T4, and calcitonin. So more the thyroid hormone, the patient is going to have hyperthyroidism, and less the thyroid hormone, it's going to be hypothyroidism. Enlargement of the thyroid gland is known as goiter. Okay, a goiter doesn't usually indicate whether it's hypo or hyper. In that case, we have to go for the clinical signs, the patient's history, and we have to do some lab tests. Okay, so it's going to be serum T3, T4, and TSH. Okay, by that we can actually conclude whether the patient has hypo or hyperthyroidism. And these are the differences. So the easy way to remember the difference is kind of relate with the metabolic rate. More metabolism means more breakdown, more calorie burn. Okay, the patient is going to feel more hot, and the opposite is for hypothyroidism. Now the next endocrine gland is pancreas. Okay, pancreas. So let's have a look at the image. So this is a pancreas. As you can see, this is a part of the duodenum. So the pancreas is a mixed gland because it has both exo and endocrine function, which we saw before in a few of the images. So what does pancreas do? So whenever we take food, suppose if we take carbohydrate, the carbohydrate is being broken down to a simple form known as glucose. So once the glucose enters our blood, we have high level of glucose. Now this stimulates the pancreas to release insulin. So as you can see, insulin is being released. So these are the insulin hormones. Okay. So what happens? Insulin will uh, kind of divert all the extra glucose inside the cell. This is a cell. Okay. So this is a cell. So the hormone insulin, what happens? It's being secreted from the pancreas, and it will divert the extra glucose inside the cell. Okay. So this is what happens in a healthy individual. Okay. Now pancreas is located partially behind the stomach in the left upper quadrant. Remember, left upper quadrant in abdomen, we divided the abdomen in four quadrant, which is RUQ, LUQ, RLQ, and LLQ. Okay, so four quadrants. The endocrine tissue consists of specialized hormone-producing cells known as islets of Langerhans. Okay, I'm going to show it in the next slide. So the function endocrine is insulin and glucagon. So what does insulin do? It diverts the glucose inside the cell. So what happens as a result? The blood glucose level decreases, right? And glucagon, it does the opposite. Suppose if you're fasting or you became hypoglycemic. So what happens? All the glucose is being diverted in the reverse pathway, which is from the cell towards the blood. So glucagon does this function. It increases the blood glucose level. And the exocrine function is digestive enzymes, which is amylase, lipase, and protease, which we discussed in digestive system. Okay. Next is what is diabetes mellitus? Okay, so to make it very simple, if a patient doesn't have insulin production, if a patient doesn't have insulin production, or the patient has decreased rate of insulin production or abnormal rate, in that case, this is known as diabetes mellitus. So either absence of insulin or abnormal insulins. Okay, so this is diabetes mellitus. Now let's have a look how this is derived. So the word diabetes is derived from the Greek word, okay, diabenein, which means to pass through, and the word mellitus, it means sweet. Okay, so what happens in diabetic patient? Usually they have a tendency to, urinate more, right? Urinate more, and usually inside the urine there is high content of sugar or glucose. So diabetes means to pass through sweetened substances, means sugar in the urine. Okay, so this is how it is derived. All right. So let's have a look what happens in diabetes. Now, as you can see, okay, before that, I think I'll explain this slides at first. Okay. Okay, we'll come back to this slide after this slide. Okay. Now, what is diabetes mellitus? Lack of insulin secretion in the blood. The glucose cannot enter into the cell. The level of glucose rises too high, and all the tissue becomes deprived of glucose. All right. So let's have a look now. So as you can see, there is no insulin production in case of diabetes. There is a cross sign here, which means the excess glucose in the blood cannot be diverted inside the cell, right? So the cell is not getting nutrition and it is getting deprived. So the level of glucose in the blood becomes very high. So what happens if the level of glucose becomes very high in blood? It tends to pass through the urine. Okay. Once it passes through the urine, being an osmotic particle, it tends to pull the water with it. That's why a patient who has diabetes has more urination and the urine contains high level of glucose. Okay. It might seem a bit complicated right now while I'm explaining to you because usually in case of pre-ST, we draw diagrams and we try to elaborate it more. But since this is a live session, we have very limited time, so I'm just trying my best to make it explain to you. Okay, and this is another type of diabetes. The same thing happens here. Although insulin is present, but the insulin structure and receptor is abnormal. So similarly, the tissue is being deprived of glucose, and all the glucose is passing from the blood with the urine, taking all the water with it. Okay. All right. So this is the diagram of a pancreas. This is a duct. So this is the exocrine part, and these are the cells containing the hormones. This is the endocrine part, which is known as islets of Langerhans. Okay. All right. Now let's come and let's have a look at the symptoms. Okay. What is going to be the patient's complaint? So usually a patient who has diabetes or suspected diabetes presents with 3P. Okay. So 3P means P for polyuria, which means increased urination. Poly means more. Okay, increased urination. The second one is polyphagia. Phagia means food, so increased appetite. And the third one is polydipsia, which means increased thirst. Okay, so I have already explained how polyuria occurs here and how, how polyuria occurs. So what happens? Once the blood glucose level is high, the glucose tends to pass through the urine. Since it's an osmotic particle, it's going to draw the water with it. So if excess water passes in urine, this is known as polyuria. Okay. Now, if the water content decreases inside the blood, what's going to happen? The patient is going to get dehydrated, right? Less water content. So as a result, what will happen? The patient will feel very thirsty. Okay. So as you can see, polydipsia, increased thirst. All right. Can you relate it? Polyuria and polydipsia. Now, why does polyphagia occur? Because the glucose is being released outside the body with the urine, and the cell is deprived. So the patient is always hungry because the glucose is not reaching its cells. Okay, so the patient will present with increased appetite. This is known as polyphagia. So the way to remember is 3P: polyuria, polyphagia, and polydipsia. Now let's have a look with the other symptoms. So other than this 3P, the patient is going to present with weakness. Okay, then blurred vision, Usually patient with diabetes tend to have eye problems like cataract, okay, vision loss, wound healing delay. Okay, there's a spelling error here, sorry for that. Okay, so in case of wound healing, what happens if there is more glucose inside the blood? Okay, more bacteria will develop there, and it will delay the healing of the wound. So a patient with diabetes, if there is a cut, usually there is a delay in healing, all right, because of increased count of bacteria. Okay, and numbness in the body. Now, what is numbness? We will discuss this in neurology. So for now, numbness usually means আমি যদি বাংলায় বলি যে পেশেন্টের অনুভূতি থাকবে না ওখানে, okay, patient won't feel anything, all right. Now the difference. Now let's have a look from the beginning once again. So I discussed about pancreas, where pancreas is located. It's located in the left upper quadrant near the stomach, and it has both function, endo and exocrine function. Then I discussed how the function is occurring here with a healthy individual and a diabetic patient, okay, and how it is derived from the Greek word, okay. Next, I discussed about the mechanism of lack of insulin, and then we went through the symptoms and the 3P. All right. Now, diabetes is usually of two types. Okay. So one is type 1, the other one is type 2. Now, let's have a look at it. So type 1 diabetes, usually it is familial. Okay. Usually if a patient, if a patient's parents, tend to have diabetes, okay, usually it passes through to the next offspring. Okay. So it's basically genetic. All right. Type 1. And usually the symptoms appear before the age of 30 or 40, but compared to diabetes type 2, it usually appears after the age of 40, and the patient usually is obese, and there is insulin imbalance because the patient's receptors becomes inactive. Okay, it doesn't work properly. All right. So if a patient becomes obese, okay, at a very suppose the patient become obese at the age of 25 or 30, at one point what happens, the patient's insulin decreases the sensitivity, okay, and it doesn't work properly. So although the patient has insulin, but it's not working properly, so as a result all the glucose is being excreted through urine, okay. So this is one of the difference. One is genetic and the other one is acquired. Another difference is it usually occurs before the age of 40, and in case of type 2 it's after the age of 40. Now, in case of type 1, the body doesn't produce insulin, but in case of type 2, although there is insulin, but it's not functioning properly because the insulin becomes less sensitive, or the receptors becomes less sensitive to the insulin. Now, the fourth example is people with type 1, since they do not have insulin, they have to take insulin injections, okay? So, people with type 1 take insulin shots, and in case of type 2, usually we start with oral medications, okay, like metformin, and there are other examples as well. And if at one point the medication doesn't work, that moment we can actually go with insulin. All right. So these are the differences: the age, the insulin production, the cause, and the treatment. Okay. I'll let you guys have a look at the slide for a while. Okay. Now the next slide. Symptoms of the endocrine system. So we are done with pancreas, although it seemed a bit complicated, but once you go through the slide once again, through live or through our Repto platform, it's going to be a bit easy, hopefully. Okay, so the symptoms of endocrine system. So polydipsia, excessive thirst; polyuria, increased urination; then the other P was polyphagia. Weight gain, usually weight gain occurs in case of hypothyroidism, so the patient tends to gain weight, all right. Intolerance to cold in hypothyroidism, intolerance to heat in hyperthyroidism. Then we have tremor. Tremor usually means involuntary shaking of the limbs. So usually what happens, a patient who has high thyroid hormone, okay, with increased metabolism, there is presence of tremor, okay. The patient shakes a lot. There's usually tremors of the hand, okay. There is increased palpitation, and these are features of thyrotoxicosis, which is the other synonym for hyperthyroidism with more complications, okay. Then palpitation. Palpitation means increased heart rate. This is also present in case of hyperthyroidism. And the last one is hoarseness of voice. This is very interesting. And I think in pre-AST training, I will be discussing it in very details, because right now, without having a proper diagram, you won't be able to understand it, okay? But still, in case of hypothyroidism, patient is usually is going to have a change in voice, okay? Because there will be compression of the gland. Uh, the gland will compress the nerve, which is around the thyroid gland, okay? All right. Next is the tests, laboratory tests. So these are the tests which a doctor is going to prescribe a patient if the patient, presents with diabetes or thyroid. So depending on the condition, the consecutive tests will be prescribed. Okay. So the first common test is complete blood count. Whenever a patient comes, we always usually give the count, because we want to see the levels of the blood cells, the hemoglobin, and the other factors. Next is fasting blood sugar. Usually, what happens if a patient comes with the complaints of polyuria, the 3P, polyuria, polyphagia, we ask the patient to come after 6 hours of fasting, and the blood sample is given. By that, we can find the fasting blood sugar level. Then is the random blood sugar levels. Usually, this is after taking food. So fasting is before, and random is usually after. Okay. HbA1c. This is glycated hemoglobin. This is a very important test for diabetes mellitus. If I want to know if a patient's diabetic or glycemic control is all right or not for the last 3 months, we prescribe this test. Okay, HbA1c. All right. Urine examination is important because we want to detect the presence of glucose in urine. Okay, so if glucose is present, in that case, we are going to say glycosuria. Okay, glycosuria means glucose in urine. All right. Okay. Now, for thyroid function, if a patient presents with the features of hypo or hyper, maybe a patient has a huge lump at the neck, maybe a goiter. So in that case, we are going to advise the patient for serum TSH, T3, and T4. So more the level of thyroid hormone, which is T3, T4, it's going to be hyperthyroidism, and if it's less, that is going to be hypothyroidism. But there is there is another thing you guys have to know. TSH, T3, T4, these are inversely proportional, which I am going to discuss with you during the pre-AST training. Okay. All right. Next is fasting lipid panel. Okay. So what happens with fasting lipid panel? Usually, if a patient has diabetes, we advise the patient, or maybe a thyroid problem, we advise the patient to go for a lipid profile test. So in that case, there are 4 types of cholesterol which are being, tested, and we see the levels. Okay, if it's fine or not. Basic metabolic panel, comprehensive metabolic panel. Each of these panel has several tests inside, and this is going to be discussed in details during our pre-AST training. Okay, so let's have a recap of the symptoms and tests. So we saw the symptoms. So individually, hyper, as you can see, the red bolded one. So in case of hyperthyroidism, there is going to be intolerance of heat. Okay, there is going to be tremor, palpitations. For hypothyroidism, intolerance to cold, weight gain, and hoarseness of voice. For diabetes, the 3P, polyuria, phagia, and dyspsia. Okay. Next is laboratory tests. So these are the common tests. Okay, it's very important. Even if you are not a part of our training in your daily life, this test might come important, because suppose whenever you visit a doctor, as you know, doctors are very busy right now. So in that case, they might come up with several terms like TSH or T3. So if you understand what T3 TSH is, you will be able to understand very easily. Okay. Now, these are the normal levels of blood sugar. Okay, so this follow the blue colored one, avoid the orange one for now. So normal blood sugar level for fasting is 3.9 to 5.5 millimole per liter. You don't have to memorize. I'm just showing it for interest. And the second one is after meal or random. It's going to be less than 7.8. Okay. And the third one, HbA1c. So it's going to be less than 5.7%. Okay. All right. So a lot of people who are diabetic, they tend to do glucose test, prick test at home with the help of glucometer. So whenever the level of fasting is more than 5.5, it's kind of a risk. Okay. And if it's more than 7.8 after meal, it's also a risk. So these are the levels. Lastly, we have the important abbreviations, which is sodium, potassium. So Na is sodium, K is potassium. So these are parts of another test, which is known as serum electrolyte. Okay. So in that test, we usually find this, abbreviations. PTH is parathyroid hormone. T3, T4, these are thyroid hormones. So for now, you have to remember T4 only, which is thyroxine. Okay. For T3, you can forget this for now. TSH is thyroid stimulating hormone, and TFT is thyroid function test. So thyroid function test is basically these three tests, okay? These three tests, T3, T4, and TSH, okay? So this is all about endocrine system. So let's have a look at the questions, okay? Walaikum assalam, everyone. All right, so antidiuretic hormone, ADH, yes, this is the answer, very good. All right, well done. Well done. All right, so in Repto, it is a bit in details. This is a very short version, okay? So in Repto, we are going to do it in very much details. So in that case, you can understand it from there, okay? So you can do one thing. You can just, play these slides from the live. Maybe it might help a bit. All right, okay. Next is, yes, this is the answer. Okay, what is the difference between diabetes mellitus and insipidus? Okay, so I haven't taught this because insipidus is part of the urology system. So in that case, in case of mellitus, what happens? The hormone responsible. So this is insulin. But in case of diabetes insipidus, the hormone responsible is ADH. Okay, so what is the difference here? All right. So the difference is in case of diabetes and insipidus, diabetes mellitus and insipidus, the common thing is the patient will have polyuria and polydipsia. Okay, there will be more urination and there will be more thirst. But the difference is since in case of diabetes mellitus, the glucose level is being controlled. Okay, so glucose will pass in case of diabetes mellitus, but in insipidus there will be no relation with glucose. So the first difference is diabetes mellitus presents with glycosuria and the hormone responsible is insulin, but insipidus there is no glycosuria and the hormone responsible is ADH. All right, okay, so this is the answer. All right, so this is all about chapter 2. So never hesitate to dream big because all the people who have succeeded in their life are people with big dreams. Okay, so make sure to be dedicated, be responsible, and study hard. Okay, and always try to stay motivated. It's very natural that during this pandemic, it's pretty easy to become demotivated, but always try to have the positive vibes. Okay, talk with people around you who have more motivating features, okay, rather than people who actually kind of demotivate you. Okay, so always try to stay motivated. All right, thank you so much everyone for attending this live session. So as you can see, there is a quiz link there at the top of the live session. So try to attend the quiz, and immediately you'll get the answers from there. And hope to see you guys soon in my next live, which is going to be on Monday at 9 p.m. And most possibly we are going to go with chapter 6, which is going to be urinary system. Okay. So good luck, take care, and Allah Hafiz.